Hi everyone, and welcome to Trauma Care Approaches in Counseling. My name is Britton Hoover, and this is Psychology 7113, Practicum 1 for Professor Bianco. This presentation was completed on October 11th, 2025. Now for the presentation overview. Trauma care approaches is such a critical topic in the counseling field because trauma is not rare or exceptional. It is super common. As counselors, we will encounter trauma whether it is explicitly identified by the client or whether it underlies other presenting issues. Our responsibility is to understand both the frameworks and the interventions that guide effective trauma care. In this presentation, I will focus on two broad areas. The first is trauma-informed care, which is a guiding framework for how we deliver counseling services in ways that promote safety, trust, empowerment, and collaboration. The second is trauma-specific interventions, such as trauma-focused cognitive behavioral therapy, prolonged exposure, eye movement desensitization and reprocessing, narrative approaches, and mindfulness-based interventions. These therapies are designed to directly address trauma symptoms and promote the recovery. We will also discuss the implications for practice, we will explore ethical and cultural considerations, and we will reflect on how these approaches can be integrated into our work as counselors. By the end of this presentation, my hope is that you will not only be more familiar with the evidence base for trauma care, but also more confident in applying these principles and interventions into your own developing professional practice. So let's begin by looking at why trauma care matters so much in counseling practice. To begin, it is important to recognize why trauma care is so central. Research consistently shows that more than 70% of adults worldwide will experience at least one traumatic event in their lifetime, and many will experience more than that. Trauma may take the form of interpersonal violence, abuse, natural disasters, medical crisis, or systemic oppression. The impact of trauma extends beyond the psychological realm. Trauma affects the nervous system, it changes how the brain processes information, and can increase vulnerability to mental health conditions such as post-traumatic stress disorder, depression, anxiety, and substance use disorders. Trauma also influences physical health outcomes, relational patterns, and self-concept. Because of this, trauma is often present in the counseling room, whether or not it is in the client's primary presenting concern. If we are not attuned to it, we risk misunderstanding the roots of distress or inadvertently re-traumatizing clients through our interventions. This is where trauma care approaches become essential. Trauma-informed care provides a universal framework for ensuring safety and minimizing harm, while trauma-specific therapies directly target symptoms of trauma and help clients recover. Together, these approaches equip counselors to meet the diverse needs of trauma survivors in ethical and effective ways. To guide our time together, I want to share the key learning objectives for this presentation. First, we will define trauma-informed care and will clarify how it differs from trauma-specific interventions. Trauma-informed care is a framework that shapes all service delivery, while trauma-specific therapies are evidence-based interventions designed to reduce trauma symptoms. Second, we will review the research evidence supporting trauma care approaches. This includes examining systematic reviews, meta-analysis, and clinical trials from the past 5 to 7 years, with a focus on interventions such as TF-CBT, cognitive processing therapy, prolonged exposure, EMDR, narrative approaches, and mindfulness-based therapies. Third, we will discuss the implications for practice. We'll explore how trauma approaches can be applied at both the individual counselor level and within organizations. Fourth, we will consider the ethical and the cultural dimensions of trauma care, including cultural humility, refugee and indigenous perspectives, and the relational ethics of working with trauma survivors. Finally, we will conclude with a summary and discussion questions designed to help us reflect on how these approaches can be integrated into our professional practice. With these objectives in mind, let's move on to our first focus area. What exactly is trauma-informed care and how does it function in counseling practice? Now that we have established the importance of trauma care, let's define what we mean by trauma-informed care or TIC. trauma-informed care is not a specific intervention or therapy. Rather, it is a framework that guides how services are delivered across all settings. The idea is that we assume trauma is present in the lives of our clients, even if it is not disclosed, and we structure our services to avoid re-traumatization while fostering resilience. According to Baring and colleagues in 2024, the core principles of TIC include safety, trust and transparency, choice, collaboration, and empowerment. Safety refers to creating both physical and emotional environments in which the clients feel secure. Trust and transparency involve being consistent and clear about expectations and processes. The choice highlights the importance of respecting autonomy and giving clients control where possible. Collaboration emphasizes the role of shared decision-making, while empowerment involves recognizing and building upon client strengths. TIC is distinct from trauma-specific interventions such as trauma-focused CBT or EMDR. Those interventions directly target trauma symptoms, while TIC provides the foundation of how we work with all clients. By embedding TIC principles into our counseling practice, we not only create safer therapeutic relationships, but also align with broader ethical standards of care. In essence, TIC shifts the focus from asking, "What is wrong with you?" to asking, "What has happened to you?" thereby reframing the counseling process as one of healing and understanding. Next, let's look at the system-level evidence for trauma-informed care. Trauma-informed care is not only a set of principles for counselors, but also the framework for organizations and systems. The evidence suggests that when TIC is implemented at a system level, it can improve outcomes for both clients and providers. Goldstein and colleagues in 2024 conducted a systematic review of trauma-informed care implementation across health and behavioral health systems. They found that adoption of TIC practices was linked to improved client engagement, reduced dropout rates, and greater satisfaction with services. On the provider side, TIC has been associated with reductions in burnout and vicarious trauma, largely because it emphasizes staff support, reflective supervision, and organizational culture change. Melillo and colleagues in 2025 expanded on this by integrating a recovery-oriented perspective. Recovery-oriented trauma-informed care emphasizes hope, empowerment, peer support, and self-determination. This approach aligns strongly with counseling values because it treats clients not as passive recipients of services, but as active participants in their learning. At the organizational level, benefits include stronger therapeutic alliances, reduced use of coercive practices such as restraint and seclusion, and an overall shift towards a culture of compassion and collaboration. However, challenges remain. These include limited resources, leadership buy-in, and the difficulty of maintaining fidelity to TIC principles over time. Together, this body of evidence underscores that trauma-informed care is not just an individual counselor practice, but a cultural transformation that needs to take place across entire systems of care. Now, I'll give an overview of the major trauma-specific interventions. Having explored trauma-informed care as that guiding framework, we now turn to trauma-specific interventions. These are therapies designed to directly address the symptoms of trauma, such as flashbacks, avoidance, hyperarousal, while also supporting overall functioning and recovery. Trauma-informed care provides the foundation for safe and ethical delivery, but it is the trauma-specific interventions that target clinical outcomes. The most widely supported trauma approaches include trauma-focused cognitive behavioral therapy, or CF-CBT, which is often used with children and adolescents, cognitive processing therapy, or CPT, which focuses on restructuring trauma-related beliefs, prolonged exposure, or PE, which uses repeated and safe exposure to trauma memories and cues to reduce avoidance, and EMDR, eye movement desensitization and reprocessing, which uses bilateral stimulation to facilitate memory reprocessing. Other interventions include narrative approaches, which help clients reconstruct their trauma story in a coherent way, and mindfulness-based interventions, such as mindfulness-based stress reduction, which focuses on emotional regulation and stress tolerance. The choice of intervention depends on client needs, cultural background, their age, and trauma history. Importantly, these interventions are not mutually exclusive. They can be adapted, combined, or sequenced in treatment. What unites them is their grounding in empirical evidence and their focus on reducing trauma symptoms while promoting resilience and recovery. We'll now look more closely at the evidence for these interventions across different populations. It is also important to consider the barriers and enablers of trauma care. While trauma-specific interventions and trauma-informed frameworks are effective, their implementation is not without challenges. Huo and colleagues in 2023 conducted a systematic review exploring the barriers and the enablers of trauma-informed care in mental health systems. Their findings highlight key issues that are highly relevant for both counselors and organizations. Among the most common barriers are the lack of adequate training, limited understanding of what trauma-informed care means in practice, and leadership resistance to adopting new approaches. Without clear definitions and consistent models, staff often report confusion and difficulty implementing TIC in meaningful ways. Resource limitations and staff turnover further complicate implementation. On the other hand, several enablers support effective trauma care. These include ongoing supervision and reflective practice, collaboration across service providers, strong leadership, buy-in, and supportive policies at the organization and system levels. Where leaders prioritize trauma-informed approaches, staff are more likely to engage in consistent practice, and clients benefit from safer and more supportive environments. A major challenge remains the lack of standardized outcome measures for trauma-informed care. Without consistent ways of evaluating progress, it's difficult to know whether implementation is successful. This points to an ongoing need for research and for counselors to engage critically with how they measure change in trauma work. Let's turn to trauma interventions designed for children and adolescents. When working with children and adolescents, trauma interventions require specific adaptation. Hopen and colleagues in 2025 conducted a network meta-analysis on psychological interventions for pediatric post-traumatic stress disorder. Their review confirmed that trauma-focused cognitive behavioral therapy, or TFCBT, remains the most effective approach for this population. CFCBT is structured and integrates elements such as psychoeducation, coping skills training, gradual exposure to trauma memories, and parental involvement. The results show significant reductions in PTSD symptoms, as well as improvements in depression and anxiety. One of the strengths of CFCBT is that it can be delivered in both individual and group settings, making it versatile for school and community-based programs. Other interventions for children include narrative exposure therapy and school-based group interventions, which can be particularly effective in post-disaster contexts. However, Hopen and colleagues note a gap in the literature. There is still need for more culturally adapted interventions for children and youth from diverse backgrounds. For counselors, this evidence reinforces the importance of tailoring trauma interventions to developmental needs and recognizing the unique role of caregivers and schools in supporting children's recovery from trauma. Now I'll move on to trauma intervention for adults. For adults, the evidence also points to several highly effective trauma interventions. Hopen and colleagues in 2024 examined the efficacy of psychological treatments for adults who had experienced either single or multiple traumatic events. Their findings showed that both groups benefit from intervention, though those with multiple traumas may require more complex, flexible treatment. One of the strongest evidence bases exists for prolonged exposure therapy. McLean and colleagues in 2022 conducted a meta-analysis confirming that prolonged exposure is consistently effective in reducing PTSD outcomes. The approach involves carefully structured exposure to trauma memories and cues, allowing clients to process these experiences and reduce avoidance behaviors. Cognitive processing therapy, or CPT, is another robust intervention. It focuses on identifying and restructuring maladaptive, trauma-related beliefs, helping clients reduce guilt, shame, and distorted thinking patterns. For individuals with complex trauma, phase-based approaches are often recommended. These approaches begin with stabilization and skill building before moving into trauma processing. The research consistently shows that sustained treatment with adequate time for integration produces the best outcome for adults recovering from trauma. This slide highlights narrative-based approaches to trauma care. Narrative approaches represent another effective trauma care strategy. Rader and colleagues in 2023 conducted a meta-analysis of narrative-based autobiographical memory interventions for post-traumatic stress disorder. They found that these interventions significantly reduce PTSD symptoms and improve overall functioning. The basic premise is that trauma often leaves memories fragmented and disorganized, which contributes to ongoing stress. Narrative interventions work by helping clients reconstruct a coherent trauma story, integrating it into their life narrative rather than allowing it to remain intrusive and overwhelming. This process reduces avoidance and promotes meaning making. One of the strengths of narrative interventions is that they often have lower dropout rates compared to some exposure-based therapies. They can also be highly adaptable to different cultural contexts, as storytelling is a universal human practice. In counseling practice, narrative interventions align well with relational and humanistic approaches. They encourage collaboration, respect for client voice, and recognition of the client as the expert of their own story. For many clients, being able to tell their trauma story in a safe and supportive environment is a profoundly healing process. Next, I'll discuss mindfulness-based approaches in trauma care. Mindfulness-based approaches have also shown promise in trauma care. Lee and colleagues in 2024 conducted a systematic review and meta-analysis examining the effectiveness of mindfulness-based stress reduction, or MBSR, among military veterans with PTSD. They found that MBSR was effective in reducing PTSD and depressive symptoms while also enhancing mindfulness and emotional regulation. Mindfulness practices help clients observe their internal experiences with non-judgment, reducing the tendency to react automatically to trauma triggers. This allows for greater control over emotional responses and helps break cycle of avoidance. MBSR and related mindfulness programs are often delivered in group formats, which not only makes them cost-effective, but also provides peer support. They can be integrated into community mental health settings, offering an accessible adjunct to more intensive trauma therapies. Importantly, the evidence suggests that mindfulness-based approaches are most effective when used alongside trauma-focused therapies rather than as a standalone treatment. In counseling practice, mindfulness can serve as a valuable tool for building self-regulation skills, supporting clients in staying grounded as they work through trauma recovery. So, how do these approaches translate into everyday counseling practice? Now that we've reviewed the evidence for trauma-specific interventions, let's look at what this means for everyday counseling practice. Trauma-informed care, again, provides the foundation for how we engage with all clients, while the trauma-focused therapies gives us tools for directly addressing trauma symptoms. Anderson and colleagues in 2023 found that when TIC principles were integrated into HIV and mental health clinics, clients reported greater satisfaction and engagement. Similarly, Dobishak and colleagues in 2024 demonstrated that trauma-informed interventions in addiction and homelessness services improved psychosocial outcomes, including reductions in distress and greater housing stability. Saunders and colleagues in 2023 highlighted that trauma-informed approaches in acute and residential mental health settings were linked to reductions in coercive practices such as seclusion and restraint. For clients, this translates into a safer and more supportive environment. For counselors, the implication is clear. Adopting trauma-informed principles such as safety collaboration and empowerment strengthens the therapeutic alliance. When this alliance is in place, trauma-focused therapies can be delivered more effectively. Together, these approaches align with person-centered and strength-based counseling, allowing us to meet clients where they are, while supporting meaningful change and recovery. Of course, there are also challenges when applying trauma care in practice. While the evidence base for trauma care is strong, there are significant challenges when it comes to implementation in real-world counseling settings. One challenge is the lack of consistent definitions. Trauma-informed care can mean different things to different organizations, leading to uneven adoption and confusion among staff. Woe and colleagues in 2023 noted that this ambiguity makes it difficult to measure effectiveness and creates barriers to sustainability. Another challenge is staff burnout and turnover. Trauma work is emotionally demanding, and without adequate supervision and self-care practices, counselors may struggle to maintain fidelity to trauma-informed approaches. Organizational buy-in and reflective supervision are essential to counteracting these risks. A further challenge is the absence of standardized outcome measures for TIC. While symptom reduction can be tracked for trauma-specific therapies, like CF-CBT or PE, measuring the impact of TIC at the relational or cultural level is more complex. Finally, there is the risk of what some call checkbox TIC. This occurs when organizations adopt the language of trauma-informed care in policies and mission statements but fail to translate these principles into daily practice. For counselors, the implication is that we must move beyond surface-level adoption and commit to living out these principles in our interactions with clients. One promising direction is recovery-oriented trauma care. So this is the integration of recovery principles into trauma-informed approaches. Melillo and colleagues in 2025 describe recovery-oriented TIC as an approach that emphasizes hope, empowerment, peer support, and self-determination. Recovery-oriented practice views clients not simply as survivors of trauma, but also as individuals with strengths, resources, and the capacity for growth. By centering recovery, trauma care shifts from managing symptoms to fostering long-term wellness and resilience. Peer support is a central component of this model. When individuals with lived experience of trauma are included as partners in care, clients often report greater trust, increased hope, and a stronger sense of belonging. Counselors can apply recovery-oriented trauma care by collaborating with clients on goal setting, highlighting their strengths, and actively working to reduce stigma. These principles align closely with humanistic and person-centered approaches, reinforcing the counseling values of empathy, unconditional positive regard, and respect for client autonomy. By adopting recovery-oriented TIC, counselors can move beyond symptom reduction to create pathways for sustainable healing, empowerment, and community connection. This model represents a holistic approach that aligns ethical, relational, and clinical dimensions of trauma care. So let's now consider the ethical dimensions of trauma care. Ethics are at the core of effective trauma care. Working with trauma survivors requires counselors to be attentive not only to clinical interventions, but also to the relational dynamics that can either promote healing or risk causing harm. Break in 2024 highlights that trauma care demands a relational ethic. This means counselors must consistently reflect on how power, trust, and vulnerability play out in the counseling relationship. Trauma often arises from experiences where individuals' autonomy was violated. As a result, trauma care must emphasize restoring autonomy and ensuring that the therapeutic process does not replicate past harms. The ethical principles that guide this work include non-maleficence, which is the duty to avoid re-traumatization, autonomy, which requires us to honor client choice and informed consent, and beneficence, which involves prioritizing client well-being. Transparency, clear boundaries, and reflexivity are critical to maintaining these ethical commitments. In practice, this means offering clients genuine choice about pacing, interventions, and disclosure, being transparent about the limits of confidentiality, and continually checking in about safety and consent. Ethical trauma care is not simply about applying interventions correctly. It is about fostering a therapeutic environment where dignity and empowerment are central. Cultural humility is another essential aspect of trauma care. Trauma does not occur in isolation. It is shaped by cultural context, systemic oppression, and experiences of marginalization. For this reason, cultural humility is an essential component of trauma care. Ranjbar and colleagues in 2020 emphasize that trauma-informed care must be paired with cultural humility to be truly effective. Cultural humility requires counselors to engage in ongoing self-reflection, recognize their own biases, and actively work to share power in counseling relationships. It shifts the focus from assuming expertise about a client's culture to approaching the client as the expert in their own lived experience. This approach acknowledges that trauma is not only individual, but also collective and systemic. Racism, colonization, gender-based violence, and economic oppression are all different forms of trauma that shape how clients experience distress and healing. Without attention to these dynamics, trauma care risks reproducing the very inequities it seeks to address. In practice, cultural humility means asking open-ended questions, inviting clients to bring their cultural values and traditions into the therapeutic process, and being willing to adapt our approaches accordingly. When paired with trauma-informed principles, cultural humility creates a foundation for equitable, respectful, and effective trauma care. This slide focuses on trauma interventions for refugees and displaced populations. Refugees and individuals who have been forcibly displaced often carry unique trauma experiences that require adapted interventions. Daniel and colleagues in 2024 conducted a systematic review showing that brief CBT-based interventions are effective for improving mental health outcomes among refugees and internally displaced populations. These interventions are particularly important in humanitarian settings where resources are limited. Similarly, Caninian and colleagues in 2020 evaluated a culturally adapted CBT Plus program for Afghan refugees and found significant reductions in PTSD and depressive symptoms. Adaptations include the use of culturally relevant metaphors, community-based delivery, and incorporation of problem management strategies. What these studies highlight is the importance of both cultural responsiveness and scalability. Standard trauma therapies may not always be accessible or appropriate in displacement context, but when adapted to local languages, traditions, and resources, they can be both effective and feasible. For counselors, the lesson is clear. Trauma interventions cannot be one size fits all. Working with refugee populations requires attention to cultural meaning-making, an awareness of systemic oppression and forced migration, and flexibility in how interventions are delivered. This represents both an ethical obligation and a practical necessity for effective care. Now, let's highlight the Indigenous perspectives on trauma care. Indigenous communities have unique cultural frameworks for understanding and healing trauma. Panofsky and colleagues in 2021 emphasized that Indigenous trauma interventions in Canada often integrate land, spirituality, ceremony, and community connection as central components to care. These practices recognize that trauma is not only individual, but also intergenerational, rooted in colonization, residential schools, and systemic oppression. Healing, therefore, must involve community, culture, and collective identity, rather than focusing exclusively on individual symptom reduction. For counselors, this means that trauma care with Indigenous clients cannot rely solely on Western models. While interventions such as CBT or EMDR may still be useful, they need to be adapted to incorporate Indigenous worldviews and healing practices. This might involve collaborating with elders, integrating traditional ceremonies into the healing process, or aligning treatment goals with community priorities. Importantly, counselors should approach Indigenous trauma care with humility, recognizing themselves as learners and collaborators rather than experts. Ethical care requires us to honor Indigenous knowledge systems and avoid imposing Western-only frameworks. By doing so, we can contribute to reconciliation in practice and provide trauma care that is both culturally safe and clinically effective. So now, let's move on to a summary of the key evidence we've reviewed so far. As we come close to the end of this presentation, it is helpful to summarize the key evidence on trauma care approaches. First, we know that trauma is widespread and has profound effects on mental, physical, and relational health. This makes trauma care central to the counseling profession, regardless of the presenting issue. Second, trauma-informed care provides a framework for safe and ethical practice. It is not a treatment itself, but a set of principles, safety, trust, choice, collaboration, and empowerment that guides how services are delivered. Evidence shows that when TIC is implemented at an organizational level, it improves client engagement, reduces dropout, and supports staff well-being. Third, trauma-specific interventions has a strong evidence base for reducing PTSD and related symptoms. These include TF-CBT for children, prolonged exposure in CBT for adults, narrative approaches that recognize trauma history, and mindfulness-based practices that enhance regulation and stress tolerance. Each intervention has strengths, and the choice should be tailored to client's need and cultural context. Finally, trauma care must always be considered through ethical and cultural lenses. Relational ethics, cultural humility, and responsiveness to refugee and Indigenous contexts are not optional add-ons, they are central to effective care. Together, this evidence suggests that trauma care requires both a universal framework and targeted interventions integrated with ethics and culture at every stage. Next, let's look at the implication of this evidence for counseling practice. What does this all mean for us as counselors? There are several key implications for practice. The first is we must integrate trauma-informed principles into all therapeutic work. Even if trauma is not the presenting issue, assuming trauma is present helps us avoid re-traumatization and build a stronger therapeutic alliance. Next, we should be prepared to use or refer clients to evidence-based trauma therapies when appropriate. CFCBT, PE, CPT, EMDR, narrative therapy, and mindfulness-based interventions all have strong evidence bases. However, these interventions are most effective when grounded in TIC principles of safety, collaboration, and empowerment. Next, we have the ethical responsibility to consider culture in all trauma work. Cultural humility, refugee adaptations, and Indigenous perspectives remind us that trauma is shaped by systems of oppression and historical context. As counselors, we must adapt care to the client's worldview and collaborate with communities when needed. Next, we must attend to our own self-care and supervision. Working with trauma places us at a risk of vicarious trauma and compassion fatigue. Engaging in reflective supervision, peer consultation, and self-care practices is not just recommended, but it's ethically necessary. And finally, counselors can advocate for trauma-informed systems. Individual practice is important, but systemic change ensures that trauma-informed values are woven into organizations and communities. So as we now come to the end of my presentation, I want to pause and revisit the learning objectives we set out at the beginning. First, we aim to define trauma-informed care and distinguish it from trauma-specific interventions. We've seen how trauma-informed care provides a universal framework of trust, safety, choice, collaboration, and empowerment, while trauma-specific interventions directly target trauma symptoms. We reviewed recent research evidence on trauma approaches, drawing on systematic reviews, meta-analysis, and clinical studies from the past 5 years. These findings highlighted both effectiveness and areas where more work is needed, such as cultural adaptation. Third, we explored implications for counseling practice, noting how trauma-informed principles strengthen the therapeutic alliance and how evidence-based therapies can be applied within that framework. We also looked at organizational challenges, such as staff burnout and inconsistent definitions. We then examined the ethical and cultural dimensions of trauma care, from relational ethics to cultural humility, and from refugee context to Indigenous perspectives. We saw that effective trauma work must always be responsive to cultural and grounded in equity. And finally, we reflected on how trauma approaches can be integrated into counseling practice, not only at the level of an individual counselor, but also through advocacy for system-wide trauma-informed change. By addressing each of these objectives, my hope is that you now feel more informed about the evidence and more confident in how to apply these principles and interventions in your own developing practice. To close, I want to leave us with a few questions for reflection and discussion. The first question is, how can trauma-informed care and trauma-specific interventions be integrated into your current or future counseling setting? Consider not just what interventions you might use, but also how you can embody TIC principles in your relationship with clients. The next question is, what ethical dilemmas might arise when delivering trauma care? For example, how do we balance client autonomy with safety or cultural adaptations with fidelity to an intervention model? Third, how can trauma approaches be adapted to meet the needs of marginalized populations, such as refugees, Indigenous communities, or those facing systemic oppression? What would it mean to ensure that trauma care is not only clinically effective, but also culturally safe? And the fourth, what strategies do you use or do you plan to use for your own self-care when working with trauma survivors? How can counselors protect their well-being while engaging deeply in this challenging but vital work? These questions were designed to spark a reflection and dialogue that move us from research to practice and help us consider how trauma care approaches can be integrated into our professional identities as counselors. Thank you so much for your time today.